Powering Your Health is brought to you by Benson Pharmacy, 11 Main Street, A2 Old Harbor, and Wellington Dental, 57 Wellington Street, Spanish Town. Welcome to Powering Your Health with Dr. Jackie Campbell, family physician at 6 West Medical, 6 West Street, Old Harbor, St. Catherine, and university lecturer. Powering Your Health is Power 106 FM's flagship program dedicated to health and wellness, your one-stop place to power a healthy lifestyle. How can we help you to power your health? Call us anytime during the show on 876-922-41125. Send your text and WhatsApp messages to 876-279-8598. And now, here's your host, Dr. Jackie Campbell.
Good evening. Today is Wednesday, the 10th of January, 2024. Welcome to Powering Your Health. I'm your host, Dr. Jacqueline Campbell. Coming up in today's edition of Powering Your Health, our discussion topics: should non-doctors prescribe medication? Yes. And another topic will be One Health. Listen to us live on the Power 106 FM app or download the app to listen to the show at your convenience. Now, January is Random Acts of Kindness Month on Powering Your Health. Showing acts of kindness is a very rewarding experience. Now, there are 4 key areas where you can be kind. Consider being kind towards yourself. Yes, you count. Being kind to other people whom you may know or not know. Being kind to your community or humankind. Being kind to your environment. Now, here are 2 tips you can take to make someone's day a good one. The first one: help someone who is busy or feeling overwhelmed. You can ask, how can I support you today? The next one is, let someone merge into traffic. Man, I did a lot of that today. Whole heap of cars on the road. Or let someone take that parking space. Yes, I know some people are going to say, no way, Jose. But suppose it's an older person, think about it. Allow the person to take that parking space and you can go about finding another one. Try them. Do you have any questions, comments about health or any of the topics being discussed? Please feel free to call me at 876-922-41125 or send a text to WhatsApp message to 876-279-8598. We start off today's show with our opening segment. And on Tuesday the 21st of November 2023, the Minister of Health and Wellness, Dr. Christopher Tufton, announced Cabinet's approval of prescriptive rights for advanced practice registered nurses. And as the minister told Parliament, under this model, family nurse practitioners and mental health psychiatric nurse practitioners in government health facilities and the University Hospital of the West Indies will be granted prescriptive authority under specific conditions. These conditions would include no private practice privileges and that medical practitioners assess all new patients as well as review the patient when a new problem emerges or when the patient becomes unstable. Now, Dr. Yohann White wrote an article entitled Should Non-Doctors Prescribe Medication? And this was published in the Daily Gleaner of Monday, January the 8th, 2024. And I'm just going to speak, about just quote from parts of this article. Dr. White wrote, the shifting of tasks from medical doctors to other members of the healthcare team has been one strategy aimed at improving access to health services. The idea is that medical doctors will have more time for tasks that only they can do. One task that is sometimes shifted from doctors to non-doctors is prescribing medications. One concern that will be foremost in the minds of many is whether non-doctor prescribing is likely to negatively impact patient safety. And the article goes on to state that what needs to happen is that we have this dilemma where you need a careful balance between expanding access to care and ensuring patient safety. Now, Dr. White further wrote, in a busy clinic with many patients to be seen, it would not be unusual if a nurse wrote a prescription and asked the physician to sign. Usually, the physician would already have some familiarity with the case. Even more importantly, there's a certain level of trust within the team. If a team member makes an error in prescribing, someone can communicate same, giving the opportunity for corrective action without alarmist accusations. Advanced nurse practitioners have been essential to the delivery of health services in Jamaica, including providing thoughtful patient counseling, physical examination, and diagnostics they competently perform daily. Now, back in 2017, there was the discussion of experienced nurse practitioners in Jamaica being considered for prescribing powers. Variations of non-doctor prescribing have been in practice in other countries, the USA and the United Kingdom, for example. Now, we are now joined, yes, he's on. We are now joined by Dr. Yohann White. He's a medical doctor and certified infection prevention and control professional. Good evening, Dr. White.
Hi, good evening, Dr. Campbell. Good evening to your listeners as well. Thanks for having me.
Welcome once again to Powering Your Health. You have come on the show in different capacities, eh?
Always.
Yeah. Now, in your article, you wrote, and here I'm going to quote you, if we believe or are experimenting with the idea that low-risk patients can be seen by experienced, competent non-doctors for uncomplicated medical issues to decrease patient waiting time and improve clinic workflow, then this strategy could be useful. So my question to you is, what evidence is there that supports this approach?
Yes, an excellent point there. And why I stated that in the article is that it's important to be clear about the problem that we're seeking to solve.
Yes.
What is the problem that we're addressing? Is it that we're trying to ensure that patients in rural areas have better access to healthcare services? Are we trying to address waiting time in the clinics? You implement one strategy and then you end up with another problem. You go to the pharmacy with all these prescriptions now, and there's no pharmacist, or there are no medications in the pharmacy to be able to fill those prescriptions. So it's really important to think about the intended and unintended effects of any changes you're making to the health services. And when you look at the scientific literature, because medicine is supposed to be based on evidence, and there's a way to go about gathering evidence. You have to plan to do an assessment, and then you have to give time, and then you have to collect certain data, patient waiting time. You have to ask patients how they feel about the experience. You have to measure whether there are any patient safety issues, unintended harm to patients, medication errors. Yes. So a number of things that you have to think about. But in the literature, even though this non-medical prescribing or non-doctor prescribing has been in practice with different types of models,
yes,
there haven't been many studies that are well designed that compare the effects of non-doctor prescribing with medical doctor prescribing. There's a lot more that needs to be done. And, proponents of non-medical prescribing, as I've said earlier, it's really important to be clear about the problem that you're seeking to address and to be prepared to
but in our context, I would think that the couple problems to be addressed would be a decrease in patient waiting time and improvement in the clinic workflow. Uh-huh.
Those are indeed issues that patients will tell you that they have indeed. And, as I've seen written in the newspaper by proponents of the strategy, in rural areas, there may not be a physician available in a clinic, most days of the week, or that physician may just visit once per week. So allowing non-doctors to be able to evaluate and diagnose and prescribe may be a useful task-shifting strategy where you can meet those needs. But as I've maintained, it's important to think about the intended and unintended effects of doing those things. Are we going to put systems in place to audit or to capture or to allow incident reporting if there are unintended incidents? Medical errors is a big problem. In the U.S., it's the third leading cause of deaths. In the U.S., according to Johns Hopkins. So it's not a small problem, and it's worse. It could be worse in low and middle income countries. In the U.S., maybe 1 in 10 patients may be affected by unsafe healthcare when they access health services. In low and middle income countries, it may be as common as 1 in 4 patients who access health services.
So we have to be very careful.
It's a real issue.
Real issue there. What is it that you're thinking? I'm putting you on the spot here. That with non-doctor prescribing, there will be more medical errors?
Not necessarily. I'm saying that we should be mindful and we should put systems in place to assess that, because we may be proposing nurses now, but maybe there are other categories of healthcare workers who probably could be prioritized. The pharmacist, maybe somebody that you would think about because they handle the drugs, the dosing, they definitely know very well. But at the same time, nurses have a very good rapport with patients, and probably better than doctors, and the communication is better. And when you do ask patients, I've seen studies cited where in the UK, for example, when they ask patients, when you got a prescription from a doctor versus a non-doctor, how did you feel about the quality of care that you received? And in some instances or some cases, it was a better experience when they were treated by non-doctors because they could spend more time talking with a nurse, etc. So we have to consider all the stakeholders who are involved in this process. You have to think about medical counsel, pharmacy counsel, pharmacists, the patients, how they feel about it. And remember, other categories outside of those, including psychologists who may have an interest in possibly prescribing for patients with mental health conditions. So it's not just nurses, and it's a lot of moving parts. And my main argument is that we should be mindful of intended and unintended effects, and be prepared to put systems in place to capture the effects of or practice changes and policy changes.
As you know, you mentioned stakeholders. In the next segment, I'll be speaking with two of our colleagues about this particular issue. So we're going to be continuing the conversation. Interesting article. Thanks for bringing this issue out into the public domain, as it were, because this directive by the Ministry of Health, it's been there since November, but not much has been, at least as far as I have seen, not much has been said in the public domain, not much discussion about this. How do people feel about this? How do the different categories of healthcare workers feel about this? How do patients feel about this? So thanks for initiating the conversation.
And I'm open to feedback. Persons can reach me on Twitter at Caribe Wellness, and I'd be happy to respond.
Great. Thank you so
much.
very much for joining us
Take care,
tonight.
Dr. Campbell.
You're welcome. We just heard from Dr. Yohann White about issues surrounding the prescription of medication by non-doctors. Stay tuned. More on Empowering Your Health after the break.
You're listening to Power 106 FM.